Life feels heavy, right? And often anxiety makes everything even harder. Traditional treatments help some, but many still feel stuck. That is why we are talking about something new, something faster for tough depression and anxiety. The ONE-D TMS Regimen. It is a smart, brain-based approach designed for real change. Dr. Georgine Nanos at Kind Minds created this ONE-D TMS Regimen. Available at Brandeis MD, it is a big step forward in how we treat the brain. This protocol is the first ever to safely give you a full course of transcranial magnetic stimulation, or TMS, in just one day. Think about that. One day instead of weeks and weeks of appointments. The ONE-D method packs all that therapy in. It uses your brain's natural ability to change and heal. This helps fix those brain circuits that cause mood problems. The goal? To get you back to feeling like yourself, faster and for good. When you are dealing with depression, you want lasting relief, not just a temporary fix. Let us look at what other treatments offer. Talk therapy alone helps about 19% of people get better. Medications like SSRIs or SNRIs, after trying a few, about 28.5% see remission. Ketamine therapies get around 22.5%. Conventional TMS, which is good, but takes about 40 daily sessions, helps 44.9% reach remission. That is better, but imagine going to a clinic 5 days a week for 8 weeks. That is a huge time commitment, right? It is tough to stick with. Now compare that to our Kind ONE-D TMS protocol. Our real-world data shows truly better results. We see an 88% clinical response rate and a remarkable 72% remission rate. This is a massive improvement over those long, less effective standard treatments. Many people still struggle with symptoms after traditional care. The ONE-D protocol offers a quicker, more effective path to lasting remission. It takes away the burden of long treatment schedules. It helps you get back to your life sooner. These high success rates are backed by solid data. It is a clear advantage for managing tough depression. So what exactly is TMS? It is a proven, non-invasive brain treatment. No surgery, no needles. Over 40 years of research and thousands of studies support it. The FDA cleared TMS for depression back in 2008. It works by sending targeted magnetic pulses to specific parts of your brain. Think of it like a gentle reset button. These pulses create tiny electrical currents in your brain tissue. They help correct brain activity in areas that control your mood. When you are depressed, these circuits might be underactive. TMS stimulates those areas, helping them get back to normal. A big benefit of TMS, no drugs, no anesthesia, so you avoid drug side effects. No recovery time like with surgery. TMS fundamentally helps your brain change itself. It is called neuroplasticity. Your brain can reorganize its connections. By guiding this change, TMS improves your mood, your thinking, and how you process emotions. This leads to lasting relief. It is not just masking symptoms. It is fixing the underlying brain dysfunction. It offers a more lasting solution for depression and anxiety. The ONE-D regimen is a game changer compared to old TMS methods. Regular TMS usually means about 40 visits over 2 months. Daily sessions, 5 days a week. That is a lot to fit into your life. It can be hard to keep up with, especially when you are already struggling with depression. It can mess with work, family, everything. The ONE-D protocol changes all of that. Instead of a drawn-out process, ONE-D gives you 20 optimized TMS treatments in just 1 or 2 concentrated days. This accelerated schedule is all about making your brain change quickly and effectively. It brings your brain networks, those causing depression, back to normal fast. We use precise settings for the stimulation. This helps your brain's circuits rewire efficiently. This focused, powerful delivery gives your brain a strong push to reset those mood-regulating circuits. Kind Minds pioneered this. We were the first in the world to safely deliver a full TMS course in this ultra-accelerated way. We refined it with lots of real-world experience. This efficient approach does not cut corners on results. You still get deep, lasting benefits. It makes treatment much more accessible. Think how much easier this is for busy people or those frustrated by long waiting periods for relief. We have proven the ONE-D regimen works through careful study.
I'm getting my extra mind treatment in the morning before clinical training. Is my favorite treatment. It's just our provider Heather helping me out from leading our clinical team, and I've had about 3 of these, and they're absolutely amazing. I'm at 100% right now, and it doesn't hurt. And having this before work starts today. And Heather, tell us what this is doing for me.
So with Micro, we're helping to promote the neuroplasticity in the brain, where we're helping to retrain those neural pathways. By doing so, we'll end up activating more neurons here and help by that's kind of supporting more healthier thinking patterns and emotional response beforehand.
So my overall mental health, a little less stress, less anxiety, feeling good, and clearing my cobwebs so I can have a great day.
We looked at 32 adults with very tough depression. These were people who had not gotten better after trying 4 or more different antidepressants. This group is incredibly challenging. Over half of them were even still on their medications during our ONE-D treatment. This was the first real-world study of a one-day TMS protocol, reviewed by other experts. It means our data shows what happens in actual clinics, not just perfect lab conditions. This makes the findings truly relevant. To track progress, we use standard tools: the Hamilton Depression Rating Scale, HDRS-17, the Beck Depression Inventory, BDI-2, and the Patient Health Questionnaire, PHQ-9, measured depression symptoms. The Generalized Anxiety Disorder Scale, GAD-7, checked anxiety. These are the best tools doctors use worldwide. All treatments happened in a supervised outpatient setting. We kept patients safe and gave personalized care. What is crucial? We followed up with patients for 26 weeks after treatment. This checked how long the improvements lasted. It gave us key insights into long-term success. Our study findings are powerful. Even with a history of long-term, hard-to-treat depression and many failed treatments, the results were strong. A fantastic 88% of patients improved significantly, and an even more impressive 72% achieved full remission. That means their debilitating depression was gone. They felt mentally well again. And it was not just depression that got better. Anxiety symptoms dropped significantly too. That is big, because depression and anxiety often go hand in hand, making each other worse. Over half these patients were still on their meds during the study, yet they still saw such great results. This really shows how ONE-D helps, even with complex cases in real life. These findings mean ONE-D can bring real, lasting improvements. It is a real option for those who have tried everything else. It focuses on healing the brain and getting your life back, not just managing symptoms. The HDRS-17 scale, which doctors use, showed our patients started with severe depression. They had significant problems with mood, interest, and daily life. After ONE-D, those scores dropped dramatically. Many moved towards minimal or no depression by the 26th week follow-up, and these improvements were not temporary. They lasted the entire 26 weeks. This means rapid relief, which everyone wants, but also a lasting brain shift. It is different from treatments that only offer a brief respite. The HDRS-17 results give strong, objective proof of this journey to recovery. The BDI-2 is where patients tell us how they feel. It covers mood, energy, sleep, self-esteem, motivation. BDI-2 scores also dropped significantly by 6 weeks after treatment. Patients felt much less depressed. These improvements stayed strong through 26 weeks. That means lasting benefits you can feel. It means a better mood, more motivation to do things, less emotional distress. It means real gains in personal well-being. The BDI-2 results back up what doctors observed. They confirm ONE-D helps reduce depression's personal toll. It helps you find emotional balance and engage with life again. It is more than just numbers. The PHQ-9 looks at how depression affects your daily life. It asks about sleep, energy, concentration, overall function. These are vital. Depression stops you from working, learning, connecting with others. The data showed lasting improvements in PHQ-9 scores from before treatment through the 26-week follow-up. This means ONE-D does not just ease your feelings, it helps you get your daily life and quality of life back. You will find it easier to work or study. Your relationships can get better, you will enjoy hobbies again. The PHQ-9 shows ONE-D's real impact. It helps you regain productivity and contentment. Many people with depression also deal with anxiety, chronic worry, restlessness, a constant sense of unease. Does that sound familiar? The good news is, ONE-D helps with both. The GAD-7 scale for anxiety showed a significant drop in anxiety symptoms after ONE-D. Like with depression, these anxiety improvements lasted through the 26-week follow-up. This means ONE-D helps other brain circuits involved in emotions, not just those tied to depression. It reduces that anxious tension. This complete benefit shows ONE-D helps your whole mental well-being. It brings relief from both depression and anxiety. To sum it up, the ONE-D regimen gives you powerful depression treatment in just one focused day. It is gentle, meaning most people have minimal discomfort. It is safe for outpatient care, so you can go right back to your routine. This treatment uses a special machine, the ExoMind by BTL, a dual-power 3.6 Tesla system. This advanced tech delivers precise, high-dose treatment comfortably. Our study showed it is very safe. All patients finished treatment with no serious problems. It has an excellent risk-benefit profile. Clinically, it achieved incredibly high remission and response rates, not just for depression, but for anxiety too. This complete improvement really makes ONE-D stand out. These amazing results come from peer-reviewed, real-world studies, not just ideas or stories. This is a science-backed approach with proven success for real people facing tough mental health challenges. A doctor directs ONE-D, ensuring expert care and supervision. It is an evidence-based intervention based on solid research, not experimental. And crucially, those lasting improvements we talked about, they are well documented over a full 26-week follow-up. This gives you confidence in its long-term impact. If you have battled treatment-resistant depression or significant anxiety and other therapies have not worked, the ONE-D regimen is a validated, highly effective option. It is smart to understand all your choices. If you are curious about ONE-D TMS, please talk to Dr. Brandeis or Dr. Nanos. They can assess if it is right for you. Your well-being is always the most important thing.